Hello and welcome. My name is Brianne Levy, and this is my research proposal for Research Applications 1 and 2. Gestational diabetes is also referred to pregnancy diabetes, and it is quite common in pregnancy. The prevalence is 9.2% of Americans. So gestational diabetes is defined as an impaired glucose tolerance with onset or first recognition during pregnancy. So basically, women who are not diabetic can become diabetic during pregnancy, then their glucose levels typically return to normal after birth. Gestational diabetes poses numerous health risks to the unborn child, which includes fetal macrosomia, which is a large birth weight, glucose intolerance or diabetes for the baby, and metabolic syndrome, which is an umbrella term used to describe a grouping of risk factors that increase the chance of various health problems such as heart disease or stroke. ASD. ASD is autism spectrum disorder. It's an umbrella term for various forms of autism. ASD affects 1 in 6 children in North America and is defined by the DSM-5 as a complex disorders of brain development characterized in varying degrees by deficits in social interactions, impairments in verbal and nonverbal communication, as well as repetitive behaviors. And there are various severities of ASD, including high functioning and low functioning. So recent evidence states that there is a correlation between gestational diabetes and ASD. Furthermore, research suggests that there's an even higher chance of ASD if the fetus is exposed to gestational diabetes after the 26th week of pregnancy. Therefore, my research question is, do fetus that are exposed to intrauterine gestational diabetes after the 26th week of pregnancy compared to fetus that are exposed to intrauterine gestational diabetes before the 26th week of pregnancy have an increased risk of developing ASD? Throughout my presentation, I'm going to walk through the proposed study design to identify limitations and contributions and next steps needed, and I'll also aim to answer what the study contributes to current available research. The exact etiology and epidemiology of ASD is unknown, but there are identified risk factors which include heritage or genetic predisposition and environmental factors. The pathophysiology of ASD is related to gestational diabetes, is unknown and controversial. Speculation is that high glucose levels affect the fetus, but why? Many authors have various theories on the outcome, however, nothing has been scientifically proven. Okay, so what do we know to date? So far, what we know is gestational diabetes is linked with ASD, and the biological cause of gestational diabetes is related to blood plasma levels and serotonin, but there are still many unknowns. To date, there is no research available on timing and onset of maternal gestational diabetes with respect to risk of autism. This is important because it validates the need for more data and more research by identifying the lack of resources and research surrounding the 26th week of pregnancy. It invites a more focused and specific investigation into timing and onset of gestational diabetes and its implication on the health on the fetus, which is the focus of this proposed study. Additionally, there's limited paternal knowledge in all previous studies. There's an abundance of information about the mother, but very limited paternal knowledge, as sometimes the father is not involved or unknown. Many articles do not even know basic paternal information such as age. The proposed study intends to gather equal maternal and paternal data, including demographics, health history, and family history. It's important to note this gap in knowledge and lack of literature on the subject, which calls for reason for further investigation. Additionally, there is no biomarker for ASD, meaning there is no brain function test that objectively diagnoses ASD. It is a subjective diagnosis. Although this is not the study's main focus, it is interesting to see if any serotonin or blood glucose levels could affect or lead to advances in finding a biomarker for definitive clinical testing for ASD. The proposed study contributions. So we really want to identify the 26th week of pregnancy importance and its role in the development of ASD or not. We want to incorporate further study of the paternal role in ASD in offspring. And we're going to use clinical and medicinal measures to do so. So we're going to be using blood testing mainly. We're going to test glucose levels as well as serotonin and cortisol levels. Um, the biological cause of gestational diabetes is elevated levels of plasma, cortisol levels, and serotonin. Serotonin impacts prenatal and postnatal brain development, and abnormal serotonin levels in the brain cause asymmetric development of serotonergic system, which therefore leads to incorrectly connecting neural circuits. So alterations in signaling and serotonergic function are linked with ASD. Additionally, high cortisol levels are connected with many serotonin-derived pathological disorders, but further research needs to be conducted to strengthen the connection. Research suggests the best time to assess these cortisol levels is immediately after birth. So objectives. The goal of the study is to establish the relevance of the 26th week during pregnancy as related to the onset of diabetes. Can this be definitively proved? We're going to find out. And to what degree of validity can it be proved? And we also want to find out what if the father has diabetes or a history of diabetes, does this impact the fetal health? Methods. So the study design will be a prospective cohort. This is an appropriate study design because longitudinal cohort study that follows people over time. In this case, it's going to be 5 years. And it studies a group of similar individuals who differ with respect to certain factors under study to determine how these factors rate the amount of certain outcome. The outcome variable in this case is the presence of ASD, and the study will be observational in nature and will follow families from the moment of pregnancy awareness to the child's 4th birthday. Subjects and inclusion criteria. Primary subjects are pregnant women who reside in Ontario under the age of 40, and they can have diabetes or not have diabetes. We want to include all pregnant women. There's no restrictions there. Additionally, we're going to include fathers of all age and health levels and the offspring of the mother and father as well. Exclusion criteria. Pregnant women who decline participation, who cannot speak English, as well as women who are over the age of 40 because other health complications come into play when you're over 40 and pregnant. Recruitment methods. We're going to be using phone calls and emails, send them out to hospitals, to doctors across Ontario to identify pregnant patients with diabetes and without diabetes as well. Subjects and physicians will be sent a letter describing the study. In order to participate, a letter of written informed consent must be signed. So our variables, our MGD is maternal gestational diabetes. So that's an exposure variable, and it will lead to our outcome variable, which is ASD. Predictor, the development of gestational diabetes after the 26th week of pregnancy, and our main outcome will be the development of ASD in the child. This is a sample of what a data collection chart will look like. This chart shows maternal and paternal glucose levels by date and week of pregnancy. Blood sample levels will be given bi-weekly for 20 weeks. In the event that the woman does not know that they're pregnant until the 2 or 3 month mark, they will still provide and complete 20 blood tests even if it is after birth. During each blood sample, 2 tests will be taken from the mother and the father will be taken. One sample will be fasted and the one will be after eating. A chart similar to this will be used to record cortisol levels and serotonin levels. And the baby will undergo blood tests right after birth to assess cortisol levels to search for a precursor for ASD. Measurements we'll be using in the study: blood testing and recording onset of diabetes, ASD diagnosis by a psychologist or pediatrician to look for clinical manifestations of ASD. And we're also going to be using eye tracking. So during the literature review, a study was found where authors in the study used eye tracking to assess the gaze and eye interaction of a 10-month-old infant who had high risk of ASD due to family heritage, as well as infants who had a low risk of ASD due to no family history of ASD. The result found that the infants in the high-risk group had altered responses to nonverbal basic eye cues and relied more heavily on and disproportionately on moving their head instead of their eyes when reacting to cues. This is important because previous research finds the ability to follow gaze is a prerequisite for joint attention, which is compromised in children who have ASD. We're also going to be measuring serotonin and cortisol levels as well. But the most important measurement is that there needs to be a definitive diagnosis by the MD or the doctor to say yes, they have diabetes, or no, they do not, as well as ASD. So the diagnostic criteria for diagnosing gestational diabetes is controversial. There are two approaches. The preferred approach is to begin with a 50-gram glucose challenge test, and this is done in 2 steps. So on the day of the testing, a blood sample will be taken when the mother and father arrive. This will be their fasting blood glucose value, and it provides a baseline for comparing other glucose values. Then they will be asked to drink a sugary drink, and then their blood will be tested again after that. So basically what the chart is showing here, if the blood glucose level is greater than 11.1 millimole per liter, it means that they have gestational diabetes. If it's less, if it's between 7.8 to 11.1, it could mean that they do. You would have to keep comparing values, and if it's less than 7.8 or lower, it's a normal blood glucose level. I also showed the alternative approach. We're probably going to stick with the first approach, but this approach is a one-step 75-gram oral glucose tolerance test. That's what OGTT stands for there. And again, it's showing, so if the fasted value is less than 5.1 millimole per liter, or if after 1 hour after eating, it is greater than 10 millimole per liter. If any of these values shown are greater than, or it's exceeded, it can mean that their gestational diabetes is present. So that's why we're going to be using the first method. It's a little bit more clear. And millimole is the SI unit for measuring concentration of substances in the blood. For the cortisol testing and serotonin testing. So cortisol has many functions. It helps the body use sugar, glucose for fat and energy. It helps manage stress. Most cortisol in the blood is found bound to protein. Only a small percentage is free and biologically active. So blood cortisol testing evaluates both protein-bound and free cortisol, while if you did urine or saliva testing, you would only get the free cortisol. For study purposes, we're just going to use blood sampling because it is the most convenient and most accurate. And the optimal range is 6 to 23 micrograms per deciliter. Similarly, serotonin levels can be tested through blood sampling as well. Serotonin is a chemical in brain, and commonly people associate serotonin with mood levels or happiness and depression. And the optimal range for serotonin levels is 101 to 283 nanograms per milliliter. Diagnosing ASD is much more difficult as there is no real test that objectively states that yes, you have ASD. It is more of a subjective diagnosis, which is done by pediatricians and trained specialists. What we have here on the slide is an example of a questionnaire parents will be filling out at the 3, 6, 9, and 12-month mark every 3 months until the child is 4 years of age. This is called a modified checklist for autism in toddlers. It's a yes or no survey questionnaire, and based on the number of yeses at the end of the survey, the parent is able to receive a score that puts the child in a low, medium, or high risk for ASD. The definitive diagnosis must be made by a doctor to confirm and state the presence of ASD for the purposes of this study. Logistic regression is going to be used as an outcome, as the outcome is it affects one individual element. In this case, the element or intervention is the presence of gestational diabetes after the 26th week of pregnancy. Logistic regression is appropriate for this research study as the outcome must be mutually exclusive or dichotomous, meaning that the outcome is either A, the child develops autism, or B, the child does not develop autism. So basically, after all the blood sampling has been done to test the glucose, cortisol, and serotonin levels, we're going to use a series of graphs and charts to congregate all gathered data, and the data will have to be assessed to find patterns and information. Through descriptive analysis, we'll help organize and correlate and ultimately note gestational diabetes diagnosis after the 26-week mark. However, it may not be until years later that the ASD diagnosis can be made. That will have to be noted. The study is going to be using test and retest reliability methods by giving the same test on 20 separate occasions, which is the 20 blood tests. A score of 0.8 is acceptable and hopes to be found in this case. Bivariate analysis is going to be used to simultaneously analyze both variates, ASD and gestational diabetes, and explore relationships between the two and determine the presence of an association or correlation and its strength. We're going to be using binomial testing rather than a chi-square test to compare the observed distribution to the expected distribution because there are only two categories, and this will also likely give a higher p-value as well. The ethical issues expect to be fairly minimal as the study is more observational in nature and you're not interfering or withholding treatment. There's no control group or placebo group, it's just simply more observational. The only ethical issue or drawback would be if a subject decides to withdraw consent, in which case we could not use any of their information in the study. Limitations of study. Loss of follow-up due to missed or skipped appointments. It could be where we would be missing information or if people move away. The study is 5 years in length approximately, so a lot of things can change over 5 years. Something we hope to use is to provide some sort of incentive so that people do continue with the study. Another limitation is paternal information may still be unknown. The fathers may not be involved or the information may not be involved, so that may not be able to be used as we'd hoped in the proposed study. And pregnancy awareness differing dates, meaning if a woman does not know she's pregnant until 3 months in, some of her pregnancy blood tests will be post-birth, which can skew results. There's a large demand for more information to increase knowledge and improve clinical practice on the correlation between gestational diabetes and ASD. The proposed longitudinal study will provide the healthcare field with data that can improve standards of care and hopefully decrease the prevalence of ASD in children in Ontario. Thank you for listening.